Welcome to our virtual total joint replacement seminar. My name is Shannon, and I am the Orthopedic Program Coordinator at Mary Immaculate Hospital. We want to thank you for choosing Mary Immaculate Hospital to help restore you to a higher quality of living with your new total joint replacement. This presentation will help to outline the surgical process from preparation to completion, providing clear expectations regarding your orthopedic care. You play a key role in ensuring a successful recovery, and our goal is to involve you in your treatment through each step of the program. Your education and compliance will help to ensure a safe and successful surgical outcome. Please feel free to contact myself and/or our orthopedic nurse navigator, Debbie Boudet, with any questions about this presentation or your upcoming surgery. We work closely together and are here to help you. The information we talk about today will also be available in the educational booklet you received during your pre-operative testing. If you did not receive a booklet, please contact Debbie or myself and we will arrange to get you one. Pre-anesthesia testing. Once you and your orthopedic surgeon have agreed that surgery is the best option for you, your surgeon's office will send information to our pre-anesthesia testing department regarding your surgical procedure. From here, you will be scheduled for pre-operative testing and a pre-operative nursing interview. You will receive a phone call from our pre-anesthesia testing staff 3 to 4 weeks before your surgery to schedule your nursing interview and to receive our chlorhexidine gluconate or CHG cleansing solution to use 3 days before surgery. During this important scheduled time with the PAT nurse, you will be asked to share your medical history, your surgical history, your allergies to both food and medication, and your daily medications, including vitamins, herbals, and anything over the counter. Be sure to have the bottles available for this interview so that you can provide the medication name, dosage, and frequency. Your personal medical history will determine what preoperative testing you will need prior to surgery. While your nursing interview must be scheduled, your medical tests may be completed without an appointment if within 30 days of surgery. Common tests include lab work, which is non-fasting, meaning you can eat prior to this lab draw, an EKG or electrocardiogram, and a potential chest x-ray and/or urinalysis. The results of your testing will be sent to your surgeon and you will be contacted if test results are abnormal. It is also best to undergo a complete physical examination with your family physician within 30 days of surgery. Your surgeon will let you know if this is a requirement. If you have any high-risk medical conditions or see a specialty doctor, you may also be required to obtain surgical clearance from these physicians. Examples include a cardiologist or pulmonologist. During your PAT interview, you will be instructed on which medications to stop taking prior to surgery. All herbal supplements should be stopped 14 days prior to surgery. As for pain medication, nonsteroidal anti-inflammatories or NSAIDs are generally requested to be stopped 7 to 10 days prior to surgery due to the increased risk of bleeding when taking these medications. Examples of NSAIDs include Aleve, Motrin, Advil, and Mobic. Check with your surgeon regarding when to stop these medications. Medications that you may take instead for pain include Tylenol, hydrocodone, Percocet, Tramadol, Vicodin, gabapentin, Neurontin, and others. Please contact your surgeon if you need a different medication for pain during this time. Anticoagulants or blood thinning medications are also generally requested to be stopped in the weeks leading up to surgery. Examples of blood thinners include Coumadin, Plavix, Pradaxa, Xarelto, Eliquis, and aspirin. Check with your surgeon and prescribing physician regarding when to stop these medications. You may get your flu shot prior to surgery. If it is flu season and you have not yet had your flu shot, your nurse will ask you if you would like it administered during your hospital stay. Please consult your surgeon regarding any additional vaccinations. Preparing for surgery. Designate a coach. It can be a friend or family member, but should be someone who can help you for the first few days after you return home from the hospital. Your coach should be educated regarding your surgical preparation as well. Have your coach watch this video and read the booklet from the hospital as well, so that he or she can help you to stay on track during your recovery. Stop smoking. Smoking increases your risks of lung complications during and after surgery and decreases your ability to heal. If you aren't ready to stop smoking yet, try to cut back prior to surgery and refrain from smoking the day of. Stop alcohol intake, or at minimum, limit your alcohol intake at least 2 weeks before surgery. After surgery, check with your doctor before resuming alcohol intake. Eat healthy. Proper nutrition is an important factor in healing. Maintaining a healthy diet reduces the risk of heart disease, high blood pressure, and diabetes. Prepare and freeze or purchase small portioned, healthy meals for times you may be alone. MyPlate.gov is a great online reference to learn more about proper nutrition. There is also an additional nutritional tip sheet in the appendix of your educational booklet. Obtain a walker. You will need a rolling walker after surgery. It has 2 wheels in the front and no wheels in the back. Some patients also prefer a 3-in-1 chair, which can be used as a bedside toilet, an elevated toilet that fits over your existing toilet, and also a shower seat. Please ask your surgeon's office about the best place to obtain items prior to surgery. Create a safe home environment. Install hand railings where necessary, especially where stairs are involved. Check your hand railings to make sure they are secure. Remove tripping hazards such as throw rugs and long cords. Arrange furniture so that you can easily move about your house with a walker. Exercise. Exercise is the key to your recovery. Pre-operative strengthening exercise illustrations are included in the appendix of the educational booklet. Strengthening exercises should begin before surgery and continue while you are in the hospital and when you return home. Perform these exercises 2 times a day with 10 to 15 repetitions of each exercise. If you experience increased joint pain, stop the exercises. It is normal to experience muscle soreness. New exercises will be added post-operatively as your physical condition changes. Packing for the hospital. Your surgeon may be planning to send you home on the day of surgery. Advances in orthopedic surgical practices have resulted in an increasing number of patients who may discharge home on the day of surgery, recovering in the safety and comfort of their home. Ask your surgeon if he plans to safely discharge you on the day of surgery versus spending the night in the hospital. Packing for the hospital. Even if you plan to discharge on the day of surgery, it is best to have a small overnight bag packed in the event that you may stay. You should include loose-fitting clothing, such as a gown or loose pajama pants that do not drag the floor, rubber-soled shoes that tie easily, or slip-on shoes with a back, no flip-flops or sandals, personal hygiene toiletries, eyeglasses, contact lenses, and denture cases, supportive or adaptive devices such as a CPAP machine, a list of medications you are currently taking, including frequency and dosage, a method of payment for prescriptions. An outpatient pharmacy is located in the hospital for your convenience. A copy of your advanced medical directive. More information on advanced directives is included in the appendix of your educational booklet. Don't forget to label your belongings. Bring your walker if you need it adjusted by physical therapy. Otherwise, a walker will be provided for use while in the hospital. Bring your glasses, as contacts may be removed for surgery. Countdown to surgery. 4 weeks prior to surgery, you should schedule your preoperative physical, plan for a nurse from pre-admissions to call you to schedule your pre-anesthesia testing appointment. Begin preparing your home and eat 3 healthy meals per day. 10 to 14 days prior to surgery, you should stop taking medications as instructed by your physician, cease or limit alcohol intake and smoking, prepare healthy meals to freeze and reheat after surgery. 3 days prior to surgery, you should begin using the chlorhexidine gluconate or CHG skin cleansing solution. Follow the instructions provided with your solution for use in the shower 3 nights prior to surgery. Do not shower on the morning of surgery. Remember to use no lotions, perfumes, or deodorant in the 3 days prior to surgery. On the day prior to surgery, you should pack items for the hospital. You will also receive your surgical time and check-in location from your surgeon's office on the afternoon prior to surgery. Do not eat or drink anything after midnight the night before surgery. On the day of surgery, you should brush your teeth and rinse with water, but do not swallow the water. Take only the medications you have been instructed to take during your pre-admission interview with a small sip of water. Wear proper clothing that is loose-fitting and easily removed. Remember, no deodorant or lotion. Remove all jewelry and leave all valuables at home. Do not smoke on the day of surgery. Reporting to the hospital. Depending on the operating room your surgeon is utilizing for the day, you will either report to the main desk on the ground floor of the surgical pavilion, adjacent to the emergency room, or to the surgical waiting room on the second floor of 2 South Orthopedics. Enter through the main hospital entrance, which faces Denby Boulevard. Once you arrive at the hospital, you will be escorted to the pre-operative preparation area. Your skin will be cleansed with CHG wipes and your nostrils with antiseptic swabs, and you will be changed into a fashionable gown. Our nurse will review your medical records and conduct a brief physical examination to include vital signs. An IV tube will be inserted into your vein for medication administration throughout your stay. You will be provided with a blanket attached to a machine that blows warm air to help maintain a normal body temperature preoperatively, which reduces your chance of infection. Lastly, you will meet your surgeon and anesthesiologist to sign consent for surgery. After meeting your surgical team, medications like antibiotics and fluids will be administered via your IV line. Other medications may be given to alleviate any anxiety you may have. If you wear dentures, eyeglasses, or contact lenses, you will need to remove them at this time. Anesthesia information. The anesthesia team consists of anesthesiologists and nurse anesthetists who are responsible for your comfort and well-being before, during, and immediately after your surgery. They will meet with you prior to surgery to develop an anesthetic care plan for you based on your health history, medications, and personal needs. Decisions regarding the type of anesthesia you will receive are made in the pre-op period with your anesthesia team. The types available for you are general anesthesia. With this type of anesthesia, you will be unconscious throughout your procedure. A combination of anesthetic gases and medications will be used to ensure you are comfortable and asleep during surgery. As you awaken and are taken to the post-anesthesia care unit, medications will be given to alleviate postoperative pain. Regional anesthesia. This technique involves the injection of a local anesthetic to provide loss of sensation to a region of the body. Examples include spinal blocks and nerve blocks to the arms and legs. If you choose a spinal block versus general anesthesia, an injection will be administered into your lower back prior to surgery, numbing the lower half of your body. You will still be given medication to make you sleepy and unaware during your surgery. Adductor canal nerve blocks is an injection of local anesthetic onto or near a nerve for temporary control of pain. This nerve block is offered for total knee patients only due to the area of the leg it affects. It is a single injection performed prior to surgery and is utilized in addition to general or spinal anesthesia to provide you with relief for 6 to 12 hours after injection. This is a sensory block, therefore you will be able to move your leg and bear weight on it after surgery. Exparel. This medication, or a similar alternative, is injected into the tissue around the joint during the surgery to provide pain management for 12 to 24 hours. This medication is for hip and knee patients. A family member can remain with you and escort you throughout the preoperative process. They will then be instructed to go to the surgical waiting area located on the second floor. When your surgery has been completed, your family will be notified. In the operating room, your anesthesia provider will monitor and manage your vital signs. You will also be asked to breathe oxygen as you are ready for anesthesia. Once you are asleep, there will be a timeout or a verification of the correct patient and operative site for safety purposes. The average length of time for surgery is 1 to 2 hours, with revisions requiring more time. After surgery, you will be taken to the post-anesthesia care unit. also called the recovery room or PACU, where you will continue to be under the care of the anesthesiologist. Your vital signs will be observed closely as the effects of anesthesia begin to wear off. Early on, you may feel sleepy, dizzy, or confused. It is not unusual to be groggy for the remainder of the day. Once you have been deemed stable by your anesthesiologist, you will be moved from PACU to either 2 South Orthopedics or Phase 2 of the surgical pavilion, where you will recover under the care of your surgeon and our nursing staff. What to expect during my hospital stay. Pain management. Pain should be expected after surgery. Your nurse will work with you to establish pain goals to help ensure that your pain is tolerable, but do not expect to be totally pain-free. Pain medication, ice, elevation, and positioning will be used to help manage your pain. If you had a regional nerve block performed by an anesthesiologist prior to surgery, you will feel the effects of that for up to 12 hours and will likely notice a gradual pain increase as it wears off. Vital signs will be assessed every 4 hours by your nurse or nursing assistant. IV fluids will be given to help hydrate your body after surgery. Sequential compression devices, also known as SCDs, are shaped like sleeves that wrap around your legs and inflate with air one at a time. This movement imitates walking, promoting blood flow, which helps to prevent blood clots. Keep these on while in the hospital bed. They will be removed when you get up to sit in the bedside chair or walk. Support stockings or TED hose are used after surgery. They are compression stockings and may be used if ordered by your surgeon to promote blood circulation and ease swelling. You will wear them daily, removing overnight only until your follow-up with your surgeon. Ice and elevation. Ice will be provided in disposable, water-resistant bags for use during the day and night, and your leg will be elevated as tolerated to reduce swelling. Remember that elevation must be higher than the level of your heart. For my knee patients, be sure to keep your knee straight during times of ice and elevation. Incentive spirometer. This is a device that will help to exercise your lungs, preventing fluid buildup and reducing fever after surgery. You should use this device 10 times an hour to prevent pneumonia and reduce fever. Coughing and deep breathing help prevent lung congestion and pneumonia. Occupational therapy. An occupational therapist will see you as needed to assess your ability to perform daily activities such as bathing and dressing. In working with you, they will determine if you need any assistive devices to help you with grooming and dressing. Physical therapy. Expect to get up and out of the bed with physical therapy or our nursing staff within approximately 120 minutes of getting to your room. A physical therapist will work with you to ensure that you are practicing safe mobility, to include using a walker and managing stairs. While in the hospital, you will receive several different types of medication. Let's review them. Pain medication. In addition to ice, elevation, and positioning, your doctor will choose pain medications that are appropriate for you. It is common to receive narcotics, Tylenol, and anti-inflammatories to control your pain. It is important for you to communicate with your nurse regarding your pain level. We encourage you to take pain medications before you exercise and follow with ice and elevation upon completion of exercises. While you're in the hospital, you will be asked to rate the intensity of your pain through the use of a pain scale as shown on this slide. A pain scale is a line numbered from 0 to 10, with each number representing a degree of pain, 0 being no pain and 10 being extreme pain. Stool softeners. Pain medication and anesthesia will make your bowels slow to move. A stool softener, such as Colace, will be ordered by your surgeon to help promote bowel movements. Remember to stay hydrated. Anticoagulants or blood thinners. These will be administered to you after surgery to prevent the formation of blood clots. The type of blood thinner you will be taking and the duration of time for which you will take it is determined by your surgeon. It may be something as simple as aspirin. Daily medications. Your routine daily medications will be provided if you remain in the hospital. A pharmacist will review them to ensure there will be no interactions with the pain medication or anticoagulant ordered by your surgeon. Outpatient pharmacy. You will be provided with the opportunity to fill your medications at our outpatient pharmacy inside of the hospital, or you may fill your prescriptions at your home pharmacy if you wish. If you choose our pharmacy, transportation will take you by the pharmacy on your way out of the building. Please note that filling prescriptions at Mary Immaculate Hospital Pharmacy is for your convenience and does not obligate you to refill medications here. Let's go over some risks and precautions. Blood clots can sometimes occur after joint replacement surgery. They can occur in either leg as a deep vein thrombosis or DVT. When a blood clot goes unrecognized, it can break away from the vein and travel, causing damage to other organs. To prevent a blood clot, move around once an hour while awake, wear your SCDs while in the hospital bed, and take your blood thinner as prescribed. Warning signs of a blood clot include sudden shortness of breath or uncontrolled swelling that does not get better with ice elevation and pain medication. Constipation. Constipation is a common side effect of narcotic pain medication. To prevent constipation, get up and move every hour. Take a stool softener daily, such as Colace or Miralax. Drink 8 glasses of water a day to stay hydrated. Pneumonia. Pneumonia is caused by the buildup of fluid in the lungs. To prevent pneumonia, get up and move every hour while awake to encourage deep breathing, and use your incentive spirometer 10 times an hour. Infection. Infection is a risk with any surgery. To prevent infection, keep your incision covered as instructed and dry. Do not apply any lotions or ointment. Shower as directed by your surgeon. Notify your surgeon or visiting nurse if there is an increased drainage, redness, pains, odor, or heat around your incision. Take your temperature if you feel warm and call your surgeon if your temperature exceeds 100.5 degrees Fahrenheit. Wash your hands and ensure that you, your family, and your healthcare providers are all practicing proper hand hygiene. If you experience any signs of infection, call your nurse or surgeon immediately. Our goal is for you to recover at home, continuing your physical therapy and related care in more familiar surroundings. Home health services, which include a physical therapist and a nurse, will be arranged for you to make this possible. Our care manager will visit you the day after surgery to discuss home health care options. If you leave on the day of surgery, your surgeon's office has likely already set up your home health services, and they will contact you the next day. Before we end our presentation today, I want to address some frequently asked questions. When can I take a shower after surgery? Showering after surgery is dependent on your surgeon. Specific information will be provided upon discharge. Sponge bathing may be necessary in the immediate postoperative period to ensure your dressing stays clean and dry. Saran wrap or press and seal are great ways to keep your incision area dry if you shower. When will I be able to get back to work? Your surgeon will let you know when you will be able to return to work, but it is greatly dependent on your recovery and your occupation. You will follow up with your surgeon 7 to 10 days after surgery and can discuss your return to work at this time. This is also the time to discuss when you may begin driving. How long do I need to perform exercises? The preoperative exercises listed in this booklet should begin as soon as possible to strengthen your muscles to help you with your recovery. These exercises, as well as additional exercises provided by your physical therapist, should be performed until you are pain-free after surgery. How long will I need narcotic pain medication? Pain is very patient-specific. The average patient is able to alternate between Tylenol and narcotic pain medication within the first few days of having surgery, switching to Tylenol only within the first week. Keep in mind that ice, elevation, and movement is going to play a key role in pain control as well. Controlling the swelling by elevating above the level of the heart is important in lessening pain. I want to thank you for taking the time to listen to this seminar today and for choosing Mary Immaculate. We look forward to meeting you and helping you on the road to recovery. Please call Debbie or myself with any questions, comments, or concerns. Debbie's number is 757-886-6640. And my number, again, Shannon, is 757-886-6724. Thank you.